Welcome to the Crescent City, where Vital Options is in New Orleans with ASH, the American Society of Hematology. What can we do to help patients get one step ahead before things become more difficult to manage for them?
The first thing I would say is call us at LLS. I mean, we're here to help navigate all of those questions. But to give you a summary of a few of the critical questions, you want to look at your plan and say, is my physician available? Especially if you're changing plans. This is the particular issue in the Affordable Care Act. Is my physician, my specialist, so primary care physician, my hematologist, is my diagnostics center or the hospital closest to me or that I go to most often, are they in my network and available to me? And understand the cost sharing. Look at your plan and say, under the pharmacy benefit, what would I have to pay for what are often referred to as specialty tier drugs? These are the drugs that are the innovators. These are the Gleevec of the world, the Tasignas, the Sprycel. I mean, these are the ones that have changed the course of a disease. And you might look at your plan, as some of our patients do, and say, what does 30% coinsurance mean? And what it means is, when you go to fill your prescription, they're going to tell you you have to come up with $2,000. So you need to know that so you can begin to anticipate and fight for change. As I said, that's the issue in engaging with us in advocacy. Meghan mentioned earlier, oral parity is a great example. We helped 13,000 patients with that $44 million last year in copayment. We know the biggest driver of those asks were from patients taking oral therapies who basically are treated differently by their insurance companies than those taking IV therapy. If we could fix that and get parity, we could have helped twice as many patients with the same dollars. Twice as many patients get access to the therapy they need. So public policy can help a lot of patients if people will get involved with us.
And Dr. Mauro, to the patient who's watching this saying, I want to go to Dr. Mauro, I live in New York City, he's not on my plan. What do we tell those patients? How do we help patients reach key opinion leaders like yourself if you're not on their plans?
I think it's a bi-directional message. Tell them to call me, and I'll put it to my center to say, well, you know, can you help me understand this? And I think this patient is a good candidate for a clinical trial that I have. This patient needs our expertise. We should review this and have that patient call their carrier and say, I've been told, or I understand that I need certain treatment, or I need to see a certain physician, and why am I not?
So a clinical trial may be the one key way in which a patient can work through the system to get to a center of excellence with a particular thought leader through that trial.
I think it's a clear way, and hopefully it isn't the only way, but it can be. We have a very good problem on our hands where if therapy for cancer moves in the direction that it is now, we are going to see very little inpatient, intravenous, hospitalized care. So we really have to have a paradigm shift. And I'm surprised when politicians and policymakers are surprisingly informed about how that is and how effective our oral therapies are and how that needs to change. If we could extend this beyond the cancer patient population to those that care for those with cancer and their families, and they start to ask questions, hopefully we can execute that and see change, because as an individual who may face a cancer diagnosis at some point in our lives, all of us may have that. We need to ask now, because you want to ask then, but if you can ask now, that's even more powerful.
I would echo that for sure. LLS is the voice for blood cancer patients. I mentioned there's more than 1 million patients in this country living with blood cancers, and frankly, that is a beautiful thing. These patients are living longer, they are living better, and as an organization, we are working to ensure that those 1 million patients plus and the newly diagnosed patients have access to all of the treatments that they need, whether it's now or in the future. That's really one of the challenges we see, is just because you have a therapy now, there may be an issue down the road. We want to make sure we're planning today for our patients tomorrow. When we talk about someday is today in our campaigns, it means a great deal to us that these cures, these new treatments, this innovation, it's not some far off someday. It's happening today. And as an organization, we are absolutely thrilled and beside ourselves to see that day. but the work's not quite done yet.
Thank you very much for both shedding light and giving perspective to some of the urgency that we face right now.
Thank you.
Thank you.
Thank you very much.